All right. Well, hello everyone, and welcome to the last week of the CPH 2025 winter virtual review sessions. My name's Ashley Mueller, and I am the manager of educational programs at NBPHE. Throughout the session today, I'll be monitoring the chat, so feel free to interact with your fellow attendees. And if you have questions for our presenter, please make sure to put those in the Q&A section. So today's session is on communications and presented by Alexa Newman. Alexa holds a Bachelor of Arts in Biology Sciences from the University of Delaware and a Master's in Public Health and Epidemiology from the University of Pittsburgh. She's currently an environmental epidemiologist at Corvetta AgriScience, an agricultural solutions company, where she supports broad-based strategies for human exposure characterization. Alexa previously worked as an epidemiologist for the Delaware Division of Public Health in roles spanning infectious disease, population health, and emergency preparedness. She also played a significant role in Delaware's COVID-19 response. She has been certified in public health since 2021, and in her free time, Alexa enjoys cooking with her husband, reading, and knitting. So with that, let's all welcome Alexa.
Thank you so much, Ashley, and hi to everyone. So great to be here with you today. Thank you for having me, and I'm excited to share on public health communications. So let me go ahead and pull up my slides, and we can go ahead. Let me know when you can see it in full screen.
Perfect. Yeah.
Okay, awesome. All right, so today we're talking about public health communications. I know this is towards the end of the series, so hopefully you've learned a lot, reviewed a lot about the other domains. I love presenting on communications because just as in our everyday lives, communications and public health really underpin the entire discipline, and so we'll get to go over a lot of different kind of topics and things for consideration, and you can see how they'll apply to all different facets of public health. All right, so we have three kind of buckets of how today's talk will be structured. First, a little bit of background, and also kind of my thoughts on, why it's important to be certified in public health. We'll, of course, go through the content. And then I also have about 10 practice questions. So we'll go through those Q&A, and then I'm also happy to take any other questions that you may have. So we'll go into the background and, why CPH. I actually shared, in my introduction a bit about me. As she said, I've been certified in public health since August of 2021, and I can't believe now that's been, 3.5 years. I really enjoyed being certified in public health. I have led several review sessions on communications, as well as health equity and social justice. And I've also had the opportunity to both write and review CPH exam questions, which is pretty cool. So it's one of the reasons that I really enjoy having this certification, and it continues to give back to me, professionally as well. And so, you all are here because you are seeking certification in public health. That's awesome. So some of my thoughts on kind of why it's important and, just the value that it can deliver. So it really shows your commitment to public health and to furthering your education in the field. You may have formal education in public health, you may have work experience or a combination of both, but taking the extra step to get certified in public health shows, your dedication to the field. It also provides a competitive advantage, so you can distinguish yourself from others, other job applicants, other candidates. I have not necessarily been required to have a CPH in any, public health epidemiology position that I've held, but I have seen that employers do sometimes give preference to having a CPH credential because, again, it shows your commitment to the field. As a CPH, you stay really up to date on different topics and trends in public health. And I know in completing the certification or the recertification, credits, I've participated in webinars or different trainings that I might not have necessarily been involved in my day-to-day work. But, to pursue the re-accreditation or recertification, I've had a chance to explore other cool topics in public health. So that's been neat. Of course, CPH provides professional development opportunities, for example, like this, leading CPH review session. There's also really a great CPH community. So for example, there's the CPH book club, which takes place online. And so you get to chat with others, around a common theme, around a book. And then finally, just, a little fun to have some extra letters at the end of your name. But really, hopefully, you've stuck with it till the end of the series. I hope that you're feeling confident in your ability to take the exam and that you are reminded again why it's so important, and why this is such a great, activity that you're taking on. So we don't need to spend a lot of time, but just as a reminder, you can take the exam anytime you want. It's all multiple choice, and the exam is designed that it's a single best answer to the question. So it's really not designed to trick you, but rather to test your competencies in all the different domains. And you can take it at a testing center or by an online proctor. So feel free to visit the NBPHE website if you want additional details on test logistics. Before we go into the content, I would just love to hear, what's on your mind as you're preparing for the exam. Are there questions you have, preparation-wise, anything that you want to, go over, things like that? We can take a minute or so, and I'll welcome any comments or questions that you might have before we start the formal content. And it's okay also if you don't have any questions or comments.
I think one thing that people like to know is, how did you study for the exam?
Oh yeah, that's a great question. Wow, I should really include that. So I think when I took it, the different domain webinars were like pre-recorded. So I went through and I watched all of those, and I had the slides printed out so I could annotate, what was the presenter saying on top of whatever content, they had provided materials. I went through and read those. I did every single practice test that was available to me, and to identify, okay, what were my stronger areas content wise, and where did I need to spend a little more time. So at first it was just taking the test or doing the practice questions to get familiarized with kind of the types of questions that might be asked. And then as I was right before I went to take the exam, I did the practice test, like, no resources, just sitting on my computer, timed as if I was taking the actual exam, to kind of see, hey, what's the flow like? Are there any areas I still need help with? And I felt very well prepared with the materials that were available through NBPHE. So webinars such as this, and then other study resources that were available on the website. Felt totally prepared going into the exam. And I had been out of my graduate program for about 2 years at that point. So I was a little leery of going back and taking a test, but was, again, very well prepared with, my training, my on-the-job training, my education, and then what NBPHE provided.
So we had two people ask, how long did you study for?
I'm gonna interpret that as like, how much lead time did I give myself before I took the exam? So I took it at the end of August. And I think I just really used that summer, and just kind of every now and then when I had, an hour or two, I would watch a webinar, watch one of the review sessions. Of course, as I was taking those actual tests, that was a bigger block of time, the practice tests. But I probably put in maybe like 20 hours worth of preparation, kind of, as I said, over time, as I had a little bit of time here and there.
So I think let's move on with the topics today, and then we can come back to some of the preparation things at the end.
Sure.
People really appreciate hearing your viewpoint.
Yeah. All right. Sounds good. And, please feel free to keep them coming. We can address them at the end. So as you've probably seen before, there are 10 different domains to the CPH exam, about 8 to 12% per domain, depending on the domain. And we're focusing on communications today. So this is, I pulled a lot of the content from the NBPHE website. So the communication domain, excuse me, focuses on strategies and methods for addressing different populations, closing gaps, thinking about presenting information at an appropriate level based on health literacy or other considerations. Um, Communications also considers the process for creating different messages regarding health issues, health needs, recommendations, and results that are available. And then finally, communication really should facilitate team building, and it highlights the role of public health and health systems. So again, like I said, communications really underpins everything that we do in public health, and it's very important. So let's go on. There are 11 different domain areas within the communications domain. So essentially for the content section of the presentation, which is the bulk of the presentation from here on out, I'm going to have one, two, three, a couple slides on each of these domains, and we'll go through different considerations within the domains to fully cover this area. So when we're thinking about communication, thinking about doing so in a responsive, responsible, professional manner, identifying needs and gaps, assessing health literacy and applying health literacy concepts in our communications, developing and implementing communications plans, being culturally appropriate and using cultural competence, also thinking about risk communication in the event of a public health emergency or a disaster, some sort of response like that. And then also, how do we use different media platforms, social, digital, traditional, in our public health communications? How do we assess communications for their effectiveness? Applying ethical principles in our communication plans, applying facilitation skills. And then finally, how do we translate data for dissemination across a variety of audiences? So how are we communicating kind of what those numbers tell us or what those data tell us? And then I just want to take, again, one more minute here, put in the chat, what are some examples of public health communications that you have encountered or that you're aware of? So just to get us thinking about kind of how we communicate and what different communications exist.
Let me know if you want me to read them out.
I have it pulled up. Thank you,
Okay,
Ashley. Yeah. So, okay. Social media, press release, infographic, public health reports, fact sheets. I think I saw newsletter, food advisory, reports, apps, email, newsletter. Yep. These are all great. TV programs, one pagers, magazines, surveys. Awesome. Great. I'm so glad to see such a variety of responses come in. These are all wonderful examples of communication, public health communications. Let me see. I don't know if I saw, conferences, that's a good one. I don't know if I saw grants. So that's one way, right? Kind of communicating about opportunities in public health for funding or for, other resources. We have professional communications, internal communications, and, these can be lots of different things, newsletters, blogs, social media, like you all said. Lots of different ways that we communicate with each other as public health professionals and with the communities that we serve. So thanks everyone for your engagement. Now we'll go into the content and then we'll do some practice and go over any Q&A that you may have. All right, so hitting on that first domain topic, thinking about communicating in a responsive, responsible, and professional manner. Communication includes both what you're sharing, so the specific message, maybe it's an annual report on influenza, maybe it's, like I said, a grant opportunity, as well as how you're sharing it. So that platform, the messenger you're using, how it can be accessed, things like that. You're going to have a target audience in mind for your communication based on whatever it is. Consider also who else may see that message aside from the intended audience, and that may vary based on how it's being shared, who may be able to see it. And when you're communicating, very important to stick to the facts. Avoid speculating on kind of what may be, what could be. Oh, well, you don't know, but we think. Avoid using jargon that may not be well understood by your audience. So always defining acronyms and trying to use terms that would be understood by who you're speaking with. And then also avoid sarcasm and jokes. There may be a time for humor in a message depending on what the message is and who you're sharing it with, but still maintaining that level of professionalism in your communication because you own whatever message you're sharing, even if you're reporting it or sharing it, on behalf of your employer or or whatnot, you as the sharer of that message are responsible for it. And a good rule of thumb, I think we talk about this, or you may have heard it, don't say anything that you wouldn't want your grandma to read, right? So thinking about who may see that message, regardless of whether they're the intended recipient, and being an owner of that message that you're delivering. And so I've talked a lot about, okay, things that you may be sharing to outside groups, but also there's professional communication, such as what we're doing right now, information sharing between colleagues. And that's another really important way that we communicate to be able to share information ultimately for public health action. So next we'll talk about identifying communication needs and gaps. Communication looks like a lot of different things. So you have verbal communication with your words, nonverbal and your body language, as well as written communication. And it can be a combination of these or maybe just one of them, depending on, again, your audience, what you're trying to share, maybe the urgency of the message, things like that. We as individuals and the communities that we serve, we get information from a lot of different sources. So you have your personal network, those people you interact with more on a day-to-day basis, family, friends, coworkers, also the community that you're a part of. And then finally, those kind of bigger, broader sources such as social media. There are a lot of different ways that people are getting information, and we can try to leverage those different areas to really make effective messages. But again, also considering, hey, there's a lot of ways in which people are getting messaging. Also want to point out, look to what already exists and what has already been communicated. If you know that there is an effective tool, or an effective sort of communication for this specific group or message, think about how you may be able to use it again. No need to necessarily reinvent the wheel. With that in mind, also consider how it can be improved for its effectiveness and its impact. But again, kind of looking to what may already be out there and then seeing how you can leverage that as a resource to, and then identify the gaps and the needs that may have appeared since then, and then you can go ahead and share that communication. Now we'll spend some time thinking about health literacy and how to assess health literacy as well as apply different health literacy concepts. The average reading level for a US adult is 8th grade. So when we're thinking about our communications, they need to be crafted in a way that someone with that average 8th grade reading level would be able to comprehend, whether it's written, verbal, things like that. Really want to highlight the use of plain language, which makes it easier to use and understand health information. So again, those kind of the language that you use, making it easily accessible and understood by any group. Other considerations for health literacy include the use of active voice, so where the subject of the sentence is performing the action rather than receiving it. So instead of saying the lab tests were performed by the health department, you can say the health department performed the lab test. So just making the use of that active voice helps the message to be a little bit better understood, and again, helps promote health literacy. Similar to thinking about plain language, also just using common terminology, words that would be recognized by the intended audience. You can, provide definitions or examples that may help to further explain the concept that you're using. And so my final point here, use those examples or analogies or visual aids to help contextualize your message that may make it easier to understand, a little bit more familiar. So maybe you're explaining a topic and then you present maybe an example of that applied in real life to help kind of bridge the gap between the concept and then what you're trying to share. Next, we'll talk about developing and implementing communication plans. So when you are developing those plans, think about who your audience is, what their role is. It's always important, start with really who are you trying to communicate with and what message are you trying to share to them. Maybe it's an internal audience. This is a memo that's going out from a state epidemiologist to the other epidemiologist. Maybe it's an external communication. Maybe it's an article about a research study that was done. Is it a technical or a non-technical audience? What would their background be? Maybe what are they coming to the table with or not? And then think about, what are the audience's needs and motivations? What information are they seeking? Information? Are they trying to make decisions? Having a firm understanding of kind of where your audience may be can help you then develop those effective communications plans, because you're meeting them, where they're at. What does your audience know, and what do they need to know? So where are they, and what are you going to share to get them to where you want them to be, or to where they need to be for that effective, action, information, whatnot. Also, in thinking about communications plans, in public health marketing services, we talk about the 4 Ps. So those are product, price, place, and promotion. So these all kind of are in that line of communication plans. Now we'll talk about incorporating culturally appropriate approaches into communications, revisiting again the health literacy topic. So there are two sort of big buckets of health literacy. I've pulled these definitions from the CDC website. Um, Personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and for others. So that's personal health literacy. Organizational health literacy focuses on that same idea, and then it's the degree to which organizations equitably enable individuals to be able to find, understand, and use that information. So just kind of a couple key points that I always take out of when I read these definitions. So it's the ability of the individual to both access and then use the information when you're thinking about personal health literacy. So if I'm presented with something, well, can I even get to it? When I access it, do I understand it? And then am I able to use it? Organizational health literacy is just how well organizations equip those individuals to be able to do so. And also, we can think of health literacy as in sort of a bi-directional way. Health literacy is both a cause and a consequence of other health disparities. So, having poor health literacy may exacerbate health disparities, and then in the other direction, existing health disparities may not foster health literacy. So, really wanting to provide individuals with communications that or that are accessible, understandable, and useful. Also, in thinking about culturally appropriate communications approaches, involve the appropriate stakeholders, and that will always vary based on whatever it is you're trying to communicate and share with your audience. It's really important to make sure you include people who are going to be affected by the communication in that communication process. And so, thinking about that, you can use a trusted messenger. So maybe it's a community leader, maybe it's a faith-based leader, maybe it's someone in the education system. Whoever it is, use a trusted messenger to help deliver that message. And the thought there is that that person will be viewed as someone who's respected by whatever audience you're trying to reach, and so the message would then be more effective, and also that it's targeted in a way that would be received well by your audience. Consider the attributes of your intended audience. Really try to understand different needs and preferences. You may be sharing the same general message, but it may need to be tailored. It likely will need to be tailored to your different audiences based on the needs that they have, and maybe they have different preferences for how they receive communications. Perhaps if you're focusing on, say, a group of older adults, they may prefer something written, whereas a group of teenagers may like digital communication. So really, it's all about meeting people where they're at. And ultimately, we are all humans engaging with each other. Seek to understand, what is it that this person is seeking, or what are they trying to do with the information? Why am I trying to share it? And be respectful. Everyone, has a different set of beliefs and values that's going to guide their actions. So considering these all in our communication. Next, we'll focus on using risk communication models and principles during a public health emergency, crisis, disaster, thing like that. So here I have a little image. We're going to think about 3 different topics that are all related to each other. So you have a hazard, which is an agent that can intrinsically cause damage or harm. For example, the sun has the ability to cause harm. The sun represents an inherent hazard. Then you have the exposure that's coming in contact with the hazard. So, at night, we're not in contact with the sun. There's no exposure. But, you're on the beach during the summer, there's likely to be greater exposure to the sun, which is the hazard. And then sitting at that intersection, you have risk. Risk is the likelihood of experiencing harm given that exposure. And so I put these definitions up here just to get us thinking, taking a step back about, okay, well, what are we trying to explain in a public health crisis? There, again, the hazard has that intrinsic ability to cause harm, but risk is really dependent on the exposure to the hazard. And I think we can all think of different examples of ways that these concepts have been communicated. Um, it's really important in a public health crisis. We'll focus a little bit more on different techniques for it, but appropriately defining these and thinking that through. Also, in public health communications, in that again kind of disaster crisis environment, there are lots of different types of information. I pulled some information from online. So we're going to focus on three kind of big buckets where information falls into. You have misinformation, which is false information, but it's not, spread with the intention to cause harm. It's just simply incorrect information. Someone maybe misread something, someone misunderstood something, and now this information is being shared. It's incorrect, but no harm was intended with it. On the other hand, you have disinformation. So that's information which is false, but now there's an intention to manipulate the audience or to cause harm. And finally, malinformation. Malinformation is based in a truth, but it's intentionally exaggerated uh, with the intent of being misleading or again causing harm. So you can see they all have some sort of overlapping qualities, but also each of these types of information is slightly different. And so, of course, as public health professionals, it's our job to share the information that we know to be accurate to the best of our knowledge, but recognizing that there are a lot of ways that messages get spread, and there are lots of different types of information that are available. And so having an understanding of sort of maybe what may be driving this information and how it's being spread will be helpful in that kind of risk communication setting. And when you're communicating in a crisis, very important to be transparent about what you know and what you don't know, but what you're going to try to find out. And follow up then if you do get that information, if it becomes available. It is okay not to have answers to everything immediately. And in fact, right, as scientists, we know new information is always being made available. So it's just being really open about what information there is and what information we're still waiting on and sharing it when it does become available. And in a crisis, reactions are often emotional and personal. People may not be thinking logically or rationally. It's just human nature, when something is urgent or threatening, that those sort of emotional responses come about. And so keeping that in mind when you're sharing communications and understanding where your audience may be coming from and kind of how they're seeking, to act from there. Now, this is all sort of thinking about responsive communications, but to the ability that you can be prepared and be proactive, have a communications plan ready for maybe sort of general themes or kind of buckets of how you can act. So, for example, when I worked in emergency preparedness, we had different plans, in case of this public health event, this is our plan. In the case of this public health event, that's our plan. To be prepared and proactive to the extent possible. Of course, every situation is going to be a little bit different and warrants a unique response, but you can kind of have some key themes or key ways that you can act to help make that risk communication more timely, a little more smoother, and then hopefully more effective as well. And then I pulled a risk communications model from the CDC, crisis and emergency risk communication. So just thinking about different stages of kind of how we're communicating. right? Because as these situations grow and evolve, the ways in which we communicate are going to also change. So you have that kind of pre-crisis, again, thinking about that proactive era. How can you be prepared? How can you have relationships with stakeholders so that when the crisis comes about, you're better prepared and better equipped to communicate? The initial phase, kind of acknowledging what's going on, providing resources that can be available, continuing to engage your stakeholders. Into the maintenance phase, where maybe this has been ongoing, help the public understand risks, kind of get that buy-in for different support, for different response and recovery plans, um, and help individuals feel empowered to be able to make decisions. Then thinking about sort of moving to that resolution phase, um, what messages are we going to share, continue to share, being reflective on sort of what happened, and moving into that evaluation phase. What lessons were learned, what action plans can we implement for the next event should that arise. All right, now we'll move on from risk communications and think about different ways of communicating. So identify and utilize social, digital, and traditional media in your communication. We know social media is rampant. Facebook, TikTok, Instagram, Snapchat, YouTube, everything out there. Social media allows for the rapid proliferation of information, for better or for worse. So social media can help connect people more quickly who may not otherwise necessarily have been connected. But we also know that information can share, with the push of a button, that information is out there. And again, we've talked about those different buckets of information: mis, dis, and malinformation. So not only are there lots of kind of types of information, but now it can be spreading all hours of the day, all around the world. So just something to keep in mind. There are, of course, a lot of benefits to social media, and also some specific considerations. Consider a formatting of your digital messages, kind of who they're intended to reach and how you're sharing them. Keeping in mind that communication occurs in many different forms, just as we communicate verbally, written, things like that. There's visual, oral, written, graphical communications, and much more. You may leverage one of these, or you may leverage more than one of these in your communication. It depends, again, on who you're trying to reach, what you're trying to share, the urgency of the message, and things like that. And thinking about social and digital media, again, that's increasing the public's access to information, and can also help connect people. So I put on here support groups. So thinking about, maybe you want to connect people who are all living with a certain chronic disease, and maybe it's rare, so it's not necessarily prevalent in a certain geography, but across the world there may be many people um, who all have that in common, and so you can help connect people in that way, and that can be a form of information sharing. When we're thinking about these digital media platforms, really important to consider who has access to them, who can post, as well as who can respond to content. So is this communication going out, but it can't be interacted with? So say the health department is sharing something, but but the public is then not able to post comments or engage, or is it meant to be interactive? And if so, is the forum monitored 24/7? Kind of who's responsible for maintaining those communications and following up? These are all different ways or different considerations for the different media and messaging platforms. And again, you may want to use one of them, you may want to use more than one of them, depending on the specific situation. Of course, we'll want to assess our communications for effectiveness, right? That's the ultimate goal, is to not only share the message, but to be effective in doing so. So when delivering a message, think about how your audience is going to use that information. Again, are they seeking information? Is it for decision making? And if so, what decisions are they going to make from that? Kind of what is the what are the stakes associated with the decisions? Is it something that needs to be done quickly? Is it for consideration? And how is what you're going to share, how will that potentially influence their decision? But then what other information also exists? How is that being shared? What type of messages are out there, and how could that also influence your audience's decision? So trying to be mindful of all the different pieces of information that may be available to your audience and how that will ultimately impact the effectiveness of what you're sharing. And then, I talked a little bit about looking back to what's already been done. So thinking about effectiveness, be iterative, right? Consider what changes would make the message more effective, more successful in the future. Maybe after you've shared a particular message, you realize, oh man, I should have put an infographic to help better drive home the message that I'm sharing. Okay, in next year's report that I put out, I'm going to include that kind of visual aid to help my audience. So there's always an opportunity to be more effective, and that's part of what we do in communications is keeping those things in mind. We'll move now to talking about ethics, so applying ethical principles and analysis in developing communication plans as well as promotional initiatives. So communications should be accessible to your intended audiences. Consider both the channels and the language that you're using. And again, we think about health literacy and cultural competence. The average reading level for a US adult is at the 8th grade reading level. So what language are you using? How is that messaging accessible? What platforms are you using to share that messaging? Communications, of course, should be accurate. And again, science evolves. So what is known at time point A may change at time point B, but at the time that the information is being shared, it should be accurate, and there should be a way for the audience to vet the information that's being shared. Of course, we all come to the table with personal biases. Those are inevitable as humans, but to the extent possible, ensure that those biases are not influencing your intended message. So really trying to remain as neutral as possible and being a messenger of that information. Communicate respectfully and honestly. As I shared before, again, we are all humans. We are all people trying to connect, trying to learn, and trying, to do the best things for ourselves and for our loved ones. As a messenger, you should communicate respectfully and honestly. And also maintain that active listening to show that you are invested in the audience who you're working with and that you are sharing the information for their benefit. Another domain area is facilitation skills. So how to apply facilitation skills in interactions with individuals and with groups. So a couple of kind of key actions you can take in this situation. Be present, listen actively, assess the situation, kind of what are we doing here? What are the goals? Be present. Be curious, ask questions to get more information, to understand kind of that dynamic and again, what the situation is. Be flexible, pivot the conversation as needed. You're really kind of running the show, but from behind the scenes to help with those groups. Be neutral. Whenever conflict arises, we'll try to prevent it to the extent possible, but then if it does arise, help to resolve it or mitigate it, and move past it. And also be empathetic, have compassion for what others are feeling. So not everyone will share the same beliefs and values, but we can be empathetic to each other and understand where the other is coming from. And the last point that we'll talk about, or last kind of domain area, is data. So translating data for dissemination across a variety of audiences. Unfortunately, it's really easy to misinterpret or misrepresent data, whether that's intentionally or unintentionally. Again, we can think about misdis and malinformation and maybe, whether there's an intent to cause harm, but regardless, it is very easy to do so even without an intention of misrepresenting or misinterpreting data. So when you are sharing data as part of your communications, be aware of the audience's familiarity with the topic. Again, we want to use plain language and avoid jargon. Explain any kind of technical information in a way that would be best understood by your audience. And this is especially, I think, a consideration when statistical methods are involved. Anytime you start talking about different tests and hypotheses and numbers, people's eyes can kind of glaze over, and also it can be difficult to really make sense of what's going on. So being really transparent and using plain language when sharing that information. And of course, maintaining ethical standards. So respecting the confidentiality and anonymity of any data that are collected, and also being ethical in data analysis and in dissemination. And along those lines, really provide context kind of the information doesn't exist in a vacuum, or those data points don't exist in a vacuum. So kind of how are they collected? Why? Under what set of circumstances? And then wherever possible, really let your analysis speak for itself. So not providing that editorialization or that, kind of additional viewpoint, but, share the context and then let the analysis speak for itself, and let your audience do with that information what they will. I pulled a table as I prepared these slides from a communications class that I took during my MPH. I really like the way it kind of breaks out how different audiences may view these different topics in communication. So this really goes to the challenge of communicating science. So you have scientists and then the lay audiences who they're speaking with. And there are several different kind of areas for consideration here, but you can see that the scientists and the lay audience don't necessarily have the same understanding or the same kind of viewpoint when it comes to these different things. So, for example, a scientist is probably going to have a pretty high level of interest in whatever scientific topic they're sharing. Maybe a flu, an immunologist is sharing a report on flu. Wow, they're really interested in that. Your lay audience may not be so interested. So when it comes time to sharing flu statistics and information about the annual influenza vaccine, the scientist is really invested in it, but the audience may not really necessarily be as interested in it. Or thinking about the level of literacy on that topic. Scientists are going to be experts in that field, but the lay audience may not necessarily have that, very high level of awareness and understanding of whatever that particular topic is. So, as the public health professional, as the scientist, we have a certain, set of experiences and knowledge, but recognizing that the lay audience may not necessarily share that same background and share the same viewpoints. So that's kind of where you bridge the gap in what you have and then what you need to communicate. So that kind of closes out the formal content that I prepared, again, going through those different domain areas of the communications domain. So just a couple of thoughts that I have before we go into the practice questions. This is a great place to start, or to be if you've already attended the other sessions, attending the CPH review sessions. Again, the exam is really not meant to trick you, but it's really designed for you to show your competency across those public health domains. And you've already been very well prepared by going to these sessions and by the experience that you have, as well as any education you may have in public health. And definitely take advantage of the resources that are available on the NBPHE website. I have two quotes here, hopefully to motivate you a little bit. You don't have to be great to start, but you have to start to be great. You've already started, so great job there. And then your positive action combined with positive thinking results in success. This is a positive action that you're taking to set aside time for yourself to review the CPH content. Now apply a positive mindset to that, and that's a winning formula for success. So I know you all will be very well prepared for the exam. And with that, we'll go into the practice questions, and then I'm also happy to take any questions that may have come up throughout the presentation. Okay. And I believe, Ashley, you'll do a poll for these?
Yeah.
Okay.
So I'll launch it.
Okay, great.
So it looks like we have 96% said 8th grade.
Okay, awesome. Yep, average reading level for a US adult is 8th grade. So that was a recall from what I shared previously. And again, that just is important to keep in mind when you're crafting messaging, thinking about kind of the comprehension and level of awareness that people may have for different topics. All right, next question. What's the most important element of an appropriately tailored message? Again, these are all single best choice.
Yeah. Okay.
Okay, yeah. So most people responded with A, take characteristics of the target population into account. Excuse me. That is the correct answer here. So, you know, you have to think about who you are speaking to and kind of what makes this audience who they are, and what may be their motivation, what preconceived notions are they coming with, what action is it, why are you sharing this communication, things like that. um, Not to say that these other answers B, C, and D aren't important, but again, what's the most important element when you are communicating? Take into account your target population. So great job so far, everyone. All right, a recall question here. What are the 4 Ps of public health marketing?
Okay.
Okay, a little bit of a spread here, but 82% answered correctly. The 4 Ps of public health marketing services are product, price, place, and promotion. What a tongue twister there. Just a recall question, from what I shared earlier. So good work, everyone.
Yeah.
How are health communications shared?
We got 100% on this one. All of the
Awesome.
above.
Okay. Yep. They communications are shared orally, visually, written. So all the above. Just again, I include that question to remind you that there are lots of different ways in which we communicate, and you may use one or multiple of those depending on the audience and the goals that you have. Great job. All right. A health department is trying to reduce the risk of HIV/AIDS for African Americans ages 50 and older. Which of the following strategies is most important to serve this community?
Okay. Looks like we're pretty confident on this answer too for
Yep.
D.
Okay. Yeah, great job, everyone. That is the correct answer. It's to present the information in a culturally competent manner. Of course, you do want to make sure the information is evidence-based. You could make it available on social media. Don't necessarily need to. It depends on, the goals of. It depends on a lot of different factors. You would want to write it at an 8th grade reading level. But again, most people answered correctly. It's being culturally competent in the communication. So this question is focusing on, okay, a group of adults, of African American adults, or ages 50 and older, who are at risk for HIV/AIDS. So what that they represent a specific group of people. And so being culturally competent in the communication approach would be the best way to serve them. So great job. All right, how is risk defined when communicating in a public health emergency?
So a little bit more of a difference, but it looks like 64% said B.
Yep, yeah, definitely more of a spread here. B is the correct answer, and perhaps the question is maybe not as clear. It's this the question is asking like literally how is risk defined? Risk, if you'll recall from that slide I showed it where it's at the intersection of the hazard and the exposure, risk is the likelihood of harm given that the exposure occurs. Um, and I include this question to just get you to think about kind of um, when you're communicating about risk during a public health emergency, that's going to depend on whatever the hazardous agent is, but then also what that possible exposure could be. So thinking about, yes, there may be an intrinsic harm that exists out there, but what's the likelihood that your audience would come in contact with it? What's the likelihood of that harm occurring? So thinking about those concepts when you're in risk communication mode. All right, moving on. So a health department is designing a promotional intervention, and which of the following issues is most important with regard to effective communication of the information? Okay, yeah, most folks answered correctly here. The correct answer is A, the health literacy of the target population. Again, that's not to say that the visual aids, color and size, organization of those health promotion materials aren't important. It's just what's the most important consideration, and that's the health literacy of the target population. So that's how your population can access, understand, and use the information. So if the health department is designing that promotion, what is the health literacy of the population that will inform its effectiveness and ultimately, the actions that are taken from there. I think we have maybe three more questions.
Yep.
Yeah, so great job so far, everyone. Which communication technique makes it easier to understand and use health information? So this is kind of a definition question. Okay, yeah, great job. 90% of folks answered correctly here. Plain language makes it easier to use and understand health information. So that's just the communicating with language that is accessible and understandable to everyone, to your audience. And so that'll ultimately make it easier for the audience to use that health information. All right, which of the following practices is recommended during public health communication, public health risk and disaster? All right, very good. The correct answer here, excuse me, is B. So a little bit of a spread, but again, most people here answered the recommended practice, again, of these, what would be the most recommended for communicating during a public health disaster? It's being available to the media during a crisis. So the thought there is that you are readily sharing information that you have available, acknowledging what you have yet to learn, and then following up when that information becomes available. So you wouldn't want to just say no comment when the level of risk is unknown. Again, be transparent there and acknowledge what information you have yet to understand. Um, so just kind of having that presence and being available is the most important consideration here during risk communication. Smoking cessation campaign highlights better health outcomes and a healthier environment. Which of the following social marketing principles is used? So it's a campaign focused on better health outcomes and health.
Well, Alexa, it looks like you saved the most divisive ones for last.
Yes, for sure. Okay, so we'll end here. Yes, definitely a big mix. It looks like people answered A, C, and D. The correct answer here is C. And the reason that is so the campaign, what is it highlighting? Better health outcomes and a healthier environment. So the thought there is that the consumers are the one who are benefiting. What are they getting out of this? They are healthier. They have better health. They have a healthier environment. So C is the correct answer because it's prioritizing the benefit to the consumer, to that audience that you're trying to reach, rather than any marketing benefit that's being received. So I see how this could be a little misleading. Um, A is a very valid response as well, right? Focusing on behavioral outcomes because the focus, it's the smoking cessation campaign, but the more appropriate answer is that it's prioritizing the benefit to the consumer rather than the marketer benefit. So it's not maintaining a market perspective. Nobody answered that. We don't know too much about the different communication elements that are being included. So that's why D is not the best answer. Again, it's C, focusing on the consumer's benefit.
Okay, we got a couple questions if you want on that
Absolutely.
question specifically.
Oh,
So the one of the questions is what is exactly meant by market?
Um, are you asking about it in the question or the answer?
Brenda, if you want to clarify that in the question. Yeah.
Oh, which of the following social marketing principles? It just broadly sharing that. Oh, this is like a social media or like a kind of a campaign. That's really just what it's referring to. Is that it's being shared broadly as kind of this message, like a social message. I hope that helps.
And then we have another question that says, can you discuss a little bit about social marketing principles? I think what that is.
Okay, sure. So just and I think we had okay, so thinking about kind of when you're sharing messages, it's thinking about these elements of a message that you could consider. So we know that the four P's of public health marketing are product, price, place, and promotion. So just different considerations that you have when you're sharing a message. And the kind of marketing thing is more like if you're trying to market a certain product, market um, like something that you were trying to share with your audience. So let's go back to the how it's being used in the last question.
And the marketer and the market changes and it is dependent on the question specifically.
So were you sharing that or asking that, Ashley?
Just saying, sharing that,
Oh
yeah.
yes, yeah, thank you. Yeah.
Okay, can we go back to question 8, two questions before this? There was a question, this
This
one.
one.
Yeah, so the question is about why B isn't the correct answer.
Okay. So this, yeah, and I can see how B folks would think that B would be the correct answer. This is just a definition that I had shared earlier in the slides. Plain language is a technique that makes it easier to use and understand health information. It's not to say that common terminology also doesn't do that, but this was the single best answer. Plain language was the single best answer for this question.
Yeah. Okay. All right, so we answered that. And then one of them had evidence-based as one of the answers, and I believe it was a good answer, but it wasn't the best answer there. And so that's the answer for that one. Alexa had covered that. Or
Oh, this one.
yeah,
Yeah.
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 Okay, I think that answers all the questions about the questions. So any other questions about communications that you wanted to ask? I do have another question about your study,
Oh,
your study
sure.
plan. So someone asking if you study for 2 months, 20 hours a week.
No, not 20 hours a week. Um, it could have maybe some weeks are more than others. And then thinking back, maybe it was a little more than 20 hours because I guess if I'm, if I was taking those practice tests, it would have been a couple hours at a time. But I just studied over a couple months and probably put in 20 to 30 hours over that time of preparation. Um, Maybe some of you are going to need less time than that. Some of you may spend more time, or maybe you're doing it in a really short time frame. So I don't think there's one best approach. That was what worked well for me, and I think I felt, like I said, I felt very well prepared going into the exam with all the resources that were available to me. The exam was not one of those gotcha tests. It was like, hey, this is your opportunity to show what you know about public health. So I hope that helps reassure anyone.
Yeah. And if we don't have any other questions about communication specifically, if you don't mind, I can share my screen. I'll go over the study resources page and what's on the study resources page. I know we've talked about it, but I just thought if we had some time today, since we've got extra time, that we could go through that page and I can explain to you what is on the page. So let me share my screen. All right, so we've been talking a lot about different study resources. We've been putting them in the chat. So this is NBPHE's study resources page. And as Alexa alluded, we have practice tests on here, among other things. So what I'd like to do is just take a few minutes and talk about what each of these things are. So when you come to this page, you will see some that have the little dollar signs in the corner. Those ones are paid resources. So we have a few paid resources. There are a few free resources. As our presenters have said, and like Alexa said, everyone studies a little bit differently for the exam. So use what resources feel right for you. All right, so going through the resources itself, the first thing here, you'll see tips to start studying. So this is a document that has advice from NBPHE on how to prepare for the exam. So we have things about getting familiar with the test, how to study, how to plan out your study resources. So some of those questions you were asking about, like how long should I study? We have some suggestions in there about that, as well as mental and physical preparedness to take a long exam and test taking strategies. So what to do when you come to those questions that you may not know the answer, how to make an educated guess, because you want to answer every single question on the exam because there's no penalty for guessing. So this first resource will have a lot of that information. The second resource on here is the content outline. So as we've been showing in every single one of these sessions, this little wheel that shows the percentage breakdown of the exam. So the exam is 200 questions, and these percentages here mark out how many of the 200 questions are of each domain. If you want to dive deeper, which if you're taking the exam, you should click on this link that says content outline for detailed information, and it will bring up this page. This page goes through a breakdown of what that 12% is. So each one of these tasks right here are what our item writers use to write the exam questions. So I know Serena brought this up, but go through this and make sure you understand each one of these different tasks, because this is what items are written off of, and this is what makes up that 12%. Additionally, on that page, there is another thing that says reference list. This is a list of publications that the certification committee uses to back up this exam items. By no means do I think you need to buy every one of these books, but I just want you to know that all of our exam questions are backed up by some reference, and this reference list is that list of books that they use to back up those questions. All right, so let me jump back to the study resources page. So those are the first two. The next one here is the sample exam questions. All of the 200 questions on the exam are multiple choice questions. All of them have 4 response options. There's 1 correct answer. So all of the questions that you will see on the exam will all have multiple choice with 4 options to pick from. That's what this really goes over. It talks about, what kind of example questions you may see. This is just a good resource to look and understand the different types of questions on the exam. So then the next 3 items are practice tests. As you can see, these 2 practice tests are free practice tests. I absolutely think everyone who's studying should take advantage of this. These practice exams are in the same format as you will take the exam. So this is in Measure Learning, which is the exam platform that we use to take the CPH exam. So not only are you practicing for 50 questions to get a feel of the different questions, you're also practicing in the format that you will take the exam. So I suggest of those 3 practice tests, you take 1 practice test right away when you start studying. And as you're getting closer, ready to take the exam, you go back, take a second practice test. If you feel like you want to take another practice test, we do have one available. So that is always an option for you. The last thing in here is a personal action plan. This is kind of a worksheet that you can use to fill out your study plan, go through, take your practice tests, decide what your strengths and weaknesses are, and make your plan of what you need to study in all of these different areas. I'd suggest you do the practice test, also look back at the content outline. That'll give you a really good feeling of what you need to do and to make your plan. So this is just a resource that we have. If it helps you to map out your plan and what when you plan to study. All right, so down below here, we have some of the other resources. So the on-demand webinars are very similar to this review session that we are doing right now. We keep all of the previous review sessions on demand for people to be able to watch. What's nice about that is, although you attended these review sessions, if you want to go back and watch some of the other review sessions, what's great about that is you can see a different presenter's perspective on the session. So I think, Alexa, you said you used these when you were studying. Yeah. So it's great, if there's one review or there's one section that you're like, I didn't really get that. Go watch one of the other presenters. They may present the information in a different way and it'll just click for you. So those are available to you for free and you can use those. The next one here, I'm not going to click in these ones because they'll take you out to a different one, but this is the APHA CPH exam review guide. So the 2nd edition was published. This is the book that we've held up in a couple different versions. This is a great resource because it has a summary of each of the different domains. There's about 10 practice questions per section. They also have different references to different resources that they use to write the information. So it's a really good guide to go over the different domains. The Springer CPH exam review guide is a book that is a printed copy with about 600 multiple choice questions. They are working on publishing a 2nd edition. So right now the 1st edition is still out. But again, it's great if you want paper and pencil to practice questions, to go through some of those tips of when you're reviewing questions of highlighting keywords or circling keywords. It's great if you're the type of person who likes paper and pencil. Then upcoming reviews classes. So if you signed up for this review session and you're interested in potentially another review session in the future, this is where you would find a link to this. We do these about 2 times a year. So usually early in the year, so January, February, and then later in the year. So if you're interested in signing up for another one, this is where you would go. And then finally, the NBPHE CPH test prep. This is a new study resource that we've put together. And I have it open here. So it is a subscription-based, either 3 months or 1-year subscription. And what that is this right here. You can take different practice tests depending on how many items you want to take. And so let's just say I want to take 1 for 1. You'd be able to take it. and I'm just guessing so everyone can see this. You can see how well you did on it, and then with the correct answers, it'll give you what you got correct, what you didn't get correct, the rationale of why the correct answer is the correct answer, and the reference that the practice item writer used to write the item. So this resource here has lots of different practice questions in it. There are some flashcards with important different terms. You are able to make customizable, like choose how many questions you want to practice, choose what domains you want. It'll track how well you are doing in the different domains. So that is another resource that is available to you on our website. For other questions just about the certification, definitely check out the About CPH page to make sure that you check out the candidate handbook. This has information about what you need to know on exam day to prepare for the exam. Check out the facts. There's lots of answers to registration, scheduling, exam fees, exam information on here. These are all really important resources that you can definitely use as you are preparing. So with that, I'm going to stop sharing. I see there's lots of questions, so I want to make sure that I answer as they come up. And Alexa, what resources, I know you said you used the, did you use any of the books or anything?
No, I didn't pay for any resources. I just used what was available on the NBPHE website.
Yeah, definitely. People study very differently, so I definitely think that there are lots of different resources and lots of different things that people want to use. Some people can do it with just the free resources, like Alexa said. Some people like to have the book and they like to practice with practice questions. So I just want you to know what's out there because I want you to be successful and I want you to feel confident and comfortable going into the exam. So are there any other questions? All right. So the white version of the study guide, yeah, I do have a question. So the blue version is the second edition of the CPH APHA Press study guide. The white version is the first edition of the book. The first edition has the old content outline in it. However, it didn't majorly change, so I know people have used it to study. So you can go to the NBPHE website if you want to purchase the second edition. And if you have the first edition, then feel free to still use that if you feel like it still has a good overview of each of the different sections. Test prep right now, I think there's about a 350. The questions are written by our practice item writing committee. So some of the presenters that you've seen here today are on there. We are adding more and more as we can. They're just going through reviewing some questions right now too. Okay, so if you don't have any other questions, we have one more session, and that is the data analysis and informatics session. So that session is packed full of lots of useful information. I know that everyone, I'm saving the best for last. So I hope that to see everyone this Thursday. And I look forward to that. And a special thank you to you, Alexa, for being here today.
Oh, it's my pleasure. Thank you so much, Ashley. Thanks for tuning in, everyone, and good luck on the exam. I know you all have got this.
Yep.